Hi everyone, Amber Canoy here for Everyday Kentucky. We are visiting Bluegrass Orthopaedics with Dr. Christensen. Okay, so we're at your surgery center here, your specialty surgery center. I want to know why you're excited about this place.
Well, I think several reasons. Number one is we previously had a three operating room surgery center, and that was just running at 120%. The demand was so great. And so now that we've transitioned into this new 8 operating room facility, which allows us to have a lot more room and opportunity to grow and treat more patients and help more people. It's a beautiful new facility, state of the art, all sorts of strategies and technologies to reduce infection risk and provide better care for the patients. The waiting room is incredibly comfortable and spacious. And the number one thing, though, is the staff. The staff
That's what I was going to ask you.
I mean, they are incredible. And I've gone to doing, 90% of my joint replacements here instead, and compared to previously where it was a greater percentage at the hospital, just because the patients, I think, are safer treated by a superior staff that's assisting the doctor.
Wow. I mean, yeah, it's very easy to get, kind of taken in by how wonderful and up-to-date this place is and how it looks. But you're right, it really comes down to the result that you all give them.
Sure. And the technologies help, the air management helps, the ultraviolet light that we use to help reduce infection risk and bacterial burden. Those are critical, but the staff is the number one thing. These people are all, type A individuals who care passionately about our patients.
Tell me more about your joint replacement, why it's so best suited to be here.
Well, joint replacement is an operation for people that are getting older, they're wearing out their joints, but they tend to be really healthy people. And we really think it's beneficial for them to not be taken to a hospital where there are sick people. Doing joint replacement in a hospital elevates the risk of infection. Yeah. And you do it here in a perfectly sterile environment. Everyone's healthy. The patients are carefully optimized before surgery in order to increase the odds of a great result. The operations are done very efficiently, take just over an hour.
Wow.
And then the patients are in the recovery room. The nurses are tasked with getting them to stand up as quickly as possible, which helps diminish blood clot risk, and subsequently the operation is quicker, easier, and the patients have a greater chance of having a result without any complications or delays in their recovery.
Now, I know we've talked about the staff, how they make this place. What are some of the doctors that you really enjoy working with here?
Well, we've done a great job recruiting, and the two guys I work most with are Dr. Dennehy and Dr. Schaefer. They're both incredible surgeons, and I see their work on a daily basis because we trade x-rays back and forth. And I mean, they really take some terrible cases that are referred in and create a beautiful result where the patients really benefit. They're so impressive, and I can't emphasize enough how great I think they are.
All right, we'll learn more. Go online.